I was totally thrilled to see Tiffany today. She healed really well and very quickly. I think the post-op period for her was notably simple. You know, some patients do experience a little bit more swelling, so she got very lucky when it comes to swelling. Her incisions have faded to the point they're almost impossible to see, and it's only 3 months post-op at this point. She seems more confident, and you know, it's changed the way that she views herself, and I absolutely love to see that. The other thing that's incredible is that her creases are perfectly symmetric and natural looking. So in my opinion, it's been a fantastic experience for all of us, and we're so happy for her.
I feel like they're awesome. Like, I feel more confidence. I love doing makeup now. I just feel very pretty now. Actually, I was quite surprised at how fast it healed. Like, I was expecting longer, and now it's actually quite, like, I can't even see the scar or anything. My friends and family, actually, like, their reaction was actually, like, they were like, wow, it looks really good. Like, all of them actually thought, like, you know, it healed quite well. And like, actually, a lot of my friends actually couldn't wait to do makeup on me, because like, just, you know, doing a makeover, and my mom loves it, my boyfriend loves it now, and yeah, everybody just loves it.
Well, Tiffany, it's been 3 months now since your surgery, and the last time I saw you was probably the day I took your stitches out. Mm-hmm. You had quite a bit of swelling and bruising, and that's normal, but it's completely gone. In fact, I know that you went to Las Vegas for a trip just after that, mm-hmm. and it seemed to have gone fine, so that's good. Today, what I'm seeing is that your creases are very symmetric, so you know, we were extremely careful to make sure that we made the incisions exactly at the same spot on each side. Sometimes the anatomy of the eyelid itself can determine where the crease sits, but I think in your case, your eyelid anatomy must be very symmetric as well, because your crease height's really good. I've just measured the crease heights here, and they're exactly the same on both sides, and they're sitting at about 7 to 8 millimeters on both sides, which is really ideal. You've got a nice fold that tapers towards the inner aspect of the eye, which we call an inside fold, which is what you wanted, what we planned, and looks really good. Mm-hmm. So I'm very pleased with that. I noticed that even with your eyes closed, I can't really see the incisions unless I look very closely. So that's, again, one of those things that with the incisional technique, you know, because you do have that small incision, people are always concerned that they're going to see a scar there. But as in most people, you really don't see it in the end. Mm-hmm. And so I think it's a great technique to allow for a very precise shape to be created. And it's also good in patients who maybe their skin is a little thicker and it may not necessarily work to just use a stitch for that. So I think the recovery period is a little bit longer initially, mm-hmm. but in the end you get a great result, yeah. and really there's no evidence that you've had surgery, and I'm really pleased with that.
Mm-hmm. My very first impression of Dr. Bonacici was that like, he offered the two techniques. And like, you know, he wasn't like, you know, you should definitely go, like, he wasn't like, you know, you should go for this one for sure. It was more like a, you know, he gave me two different options, and like the results of it and the negatives of each one. It's just whatever what suits me. Yeah, like, so I felt like it wasn't like, you know, he was forcing anything on me or anything like that. It was totally up to my decision. I would definitely recommend Dr. Bonacici to my friends. Like, he was awesome. Like, there was nothing that I didn't like about him.